Hello, everyone. My name is Christiane Smith, and this is my professional development presentation for the Principles of Public Health class. For my interview, I interviewed Brittany O'Neill. Brittany O'Neill is a registered dietitian and nutritionist, and she works at the DaVita Dialysis Center. She went to the University of Texas at Austin, where she received her Bachelor's of Science degree in nutrition, and then she went to Texas A&M University in Kingsville, where she received her Master's of Science in Human Sciences. Brittany's journey into public health. Brittany gained an interest in nutrition when she was younger, and this continued throughout her life. She actually told me originally her major was math at the University of Texas, and then she changed her major to nutrition when she talked to her advisor. Her career started in 2020 as a dietitian in a nursing home, and working that job led her to her position today at DaVita Dialysis. In 2020, she discussed the impact of COVID-19 on her profession, and she stated that there was a lot of protocol to be mindful with visiting different nursing homes, as she was contracted to a total of 9 during this time. She also was mindful during kitchen audits as she was reviewing the diets of the different nursing homes for various patients. When asked her favorite thing about her work, she says talking with patients and interacting with coworkers. She also stated when patients make progress through the different labs or overcoming other challenges they may have had, she says that's her favorite thing when her patients are motivated. Some challenges that she has faced in her job are some things that are out of her control. As we have studied in this class for public health, there are some things that you can't control, such as living situations. Sometimes patients struggle to afford medication or giving different education. You can only educate as much as you can, says Brittany. When asked the recommendations for someone who is considering this field, she said, consider different internship specialties as there are various fields of nutrition. You could be working at a school, working with people with eating disorders, working in a dialysis center like Brittany does, or working in different hospitals. She says, be mindful to all of those fields. A typical day as a nutritionist. Brittany says it's constantly changing throughout the month. Some months it includes weekly and monthly meetings with healthcare teams, which includes the doctors, nurses, patient care technicians, and social workers. And other months, it's reviewing lab draws and providing patients education and creating different interventions. During the lab draw weeks, these are the most important because she prioritizes the out of range labs and she's looking for the different levels, whether that be potassium and calcium. She then rounds with the patients along with the social worker and doctor and includes education and interventions. Some interventions may include mineral and bone medications or adjustments, potassium binders, and she talks with doctors about that, and modifying the dialysate baths and talks to the team and doctors. She then redraws the labs for those patients that might be out of range and follows up on those lab results. After that, a lot of this information is charting and making sure that she keeps up with her charting on her patients. Now let's talk more about the type of work and the company that Brittany works for. DaVita means giving life. This is an adaptation of an Italian phrase. DaVita's mission statement is to be the provider, partner, and employer of choice. They state that we aim to build the greatest healthcare community the world has ever seen through our commitment of upholding our mission and core values for our patients, partners, and teammates. Okay, so Brittany works for a dialysis clinic. So what is dialysis? Dialysis is for people with chronic kidney disease, and they use this as treatment. There are different types of hemodialysis treatment. There's home dialysis and in-center dialysis. DaVita Dialysis is an in-center hemodialysis clinic. What is chronic kidney disease? Chronic kidney disease is also known as chronic kidney failure, and this occurs when the kidneys can no longer clean the toxins in the blood, which can lead to a buildup of waste in the body. The two main causes of chronic kidney disease is diabetes and high blood pressure. Diabetes is a disease where the body doesn't produce enough insulin to break down sugar from food. This causes excess sugar to remain in the bloodstream, and the high levels of sugar in the blood can cause damage to the vessels in the kidneys, which can then lead to kidney failure. High blood pressure, also known as hypertension, is another main cause of chronic kidney disease. When blood pressure is consistently too high and it is not treated, it can also damage the small blood vessels in the kidneys. So how does Brittany relate to the top 10 essential public health services? Brittany falls under the healthcare sector as she is an individual who provides health services to individuals. Her demographic is among the low income, as the clinic's location is in Houston, and also it's many people of color. According to the National Kidney Foundation, Black or African Americans are more than 3 times as likely, and Hispanics or Latinos are 1.3 times more likely to have kidney failure compared to white Americans. And visiting Brittany in this clinic, I was able to see that there was a diverse amount of patients that she works with every single day. The healthcare sector, like I said, that Brittany is a part of, is defined as entities that provide clinical services, mental health services, oral health services, provide or pay for services for individuals, or facilitate provision of services to individuals. Entities in this sector may include hospitals, health systems, health plans, health centers, behavioral providers, oral providers, etc. And that wraps up my presentation on my professional development interview with Brittany O'Neill. Thank